how to get health care now, both what you want and what you need. You have to understand the problem, commit to the solution, use the money that's being wasted now to pay for what you want and need, and determine the real cost. You have to make friends, help and trust each other, and understand the problem. Healthcare costs too much, and for no good reason. It's not that doctors and nurses are driving up the cost. Their share is about 15%. The non-professional medical supply and facilities industry charge double their value. The insurance industry charges double their value. The result of the overcharging is that every person in the USA, on the average, pays twice as much for healthcare services and insurance as other people in the world. Worst of all, the quality of care is below par and has been that way for 50 years. So we have to commit to the solution. You have to say, I'm not going to take it anymore. You have to join with your family, your friends, your neighbors, and build your own health plan. You can take the money you're wasting on health care and insurance and pay it to yourselves. And with that money, hire your own doctors, create your own facilities, and get your own supplies. That's not a crazy idea. You can also buy insurance you need as a group and at wholesale prices on your terms and based on your actual risk and experience. No middle person. You have to teach yourselves medicine and healthcare, both private and public. And you have to pay attention to the economics. And it has to be cooperative. Use that money that's being wasted to pay for what you want and need. Now, hospital and medical facilities' share of the money that is being spent now is about 40%. The waste in that is 25% of the total cost. The insurance company's share is 20%. And the waste in that is about 10% of the total cost. The pharmacy share is 10%, and the waste is 5% of the total cost. Ancillary medical and dental services is about 10%, and the waste there is about 5% of the total cost. The doctors and nurses' costs are now about 20%, but the waste because of duplication of services is about 5% of the total cost. So that means the total waste in the system is 50% of the money you are now spending. So stop it. Use that money to get what you really want and need. There's no big brother that can do it for you. Not really. Now, the real cost, if you act in your own best interest through sound budgets, mutual help, and solid trusteeship, is this. For an individual, The building fund, I mean, to have a building where you can take care of, such as a hospital and a clinic, costs the first 3,000 people that participate $77 a month. The operating fund to run the facilities, to manage them, to staff them, is $111 a month. To pay the physicians, all of them, primary care is $38 and specialists $73. Drugs are about $50, reinsurance $42, and administration $44. That's a total of $435. Now, in the United States, if you pay insurance premiums and if you pay out of pocket for what insurance doesn't cover, your cost is twice that. Not $435, but $870. Now, think about this. If you and your friends help each other, if 300 people ask 9 of their friends and neighbors to put their funds together that they will save from buying health insurance, healthcare directly, and then 3,000 families can create a complete healthcare system that will serve a population of about 30,000 people. They will be the founders and will create a system that will outlast their lives and fulfill their wants and needs. Doing this is an act of love and a correction of a problem that no one else has been able to solve with their ideas about economics, insurance, and top-down methods of management. It can be done if there's a will. Now, the method for the creation of a local cooperative healthcare system is this. 1, select a target population to serve in a specific geographical area, say an area that has 50 to 100,000 lives. Now, there are many areas of the United States, many that have that many lives. Survey that population to discover what they want and need and how they want to help. Use Ernesto Sorelli's idea. Shut up and listen. That's what he did, and it works. If the survey shows that people want and need healthcare, and have a desire to support it, then do relationship building with the people you've surveyed. Make sure these people are receiving something of significant value from you during the relationship building period. Use what you've learned from the survey to construct the healthcare system. Now, assuming that people want a comprehensive healthcare delivery system, then introduce them to a cooperative model that addresses their expressed wants and needs. As an example, projection for a cooperative model is shown above. This assumes that there's a physician team of 30 primary care practices and 15 specialty groups that would serve a population of 30,000 lives. It assumes that the target population would enroll in the cooperative, participate in the cooperative's health plan that were built on their expressed wants and needs. The cost of the facilities and the medical services are at market rates in this example, which is $30 million for the facilities and $20 million per year operations. Now, the cooperative would own the facilities and contract with the providers and hospital operators for provision of coordinated and quality medical services. Each member would pay part of their monthly health care costs to the capital fund for the facilities and operation of the facilities. During the construction period of 24 months, the members would enroll in the cooperative's health plans. The expectation is that 3,000 adults would be paying members when the facilities open. The projected cost of membership is $435 per month, including the capital fund and the operating contributions. This fee is about 40% less expensive than the current market rates. Each member would sign a pledge supported by a promissory note in the amount of $10,000. This note would be paid at no interest out of the $435 per month projected cost. If 3,000 members at $10,000 each, that means there's 30 million, and that's the entire cost of the facilities. Continuous enrollment through the 5-year projection would result in 30,000 members. Member contributions and note would be $360 million, which will support the operations for an indefinite period of time. The cost analysis you're hearing is based on the financial statements we have in file from primary care physicians, specialists in hospitals, and medical service organizations, which we've collected over the last 20 years. It is consistent with the public reports, which are produced by many physician associations, management companies, and CMS. The aim of this analysis is to test whether the fees charged by the cooperative would be adequate to cover all medical and hospital costs and pay the professional medical providers more money than they usually get from their practices. The result would be to create intrinsic motivation and autonomy for the providers and disconnect the carrot and stick methods of the current marketplace, which have been both uneconomical and ineffective. So come together, have what you want and what you need, and be in control of it with your physicians.